Hi, my name's Katie. I'm a student physical therapist assistant, and today I'm going to be talking to you about facilitory and inhibitory techniques. These are important for us to know as PTAs because we often see patients who have neurological issues that need these type of interventions. You may see patients with like strokes or spinal cord injuries or MS or even nerve damage. These are all techniques where you might need some facilitory or inhibitory techniques. Some impairments you might see with that would require you to use some facilitory techniques would be hypotonicity, so a decrease in muscle tone. Therefore, we need to facilitate to get the muscle working. And then you also might see decreased strength involved in the in this as well because their muscle is so like limp and flaccid that they can't really use the strength or muscle they have. And then in inhibitory impairments you will see is hypertonicity, meaning that their nerves are firing too much, so they're constantly in a state like this, making it hard to release from that position. And you'll see an increase in muscle tone, but decrease in strength because they can't get the muscle out of this position to work it properly. Some activity limitations that you might see with these things would be decreased ability to walk, difficulty going up and down stairs, especially if the tonicity is taking place in the lower extremity. If it's in the upper extremity, you might have some difficulty like moving, opening, closing objects with your upper extremities, like opening the fridge for a glass of milk or carrying your grocery bags, things that you might do, pretty frequently. And then also self-care, so like brushing your teeth or brushing your hair. For like key principles in clinical application, I would apply the facilitory technique to my patient if they present with hypotonia, meaning decreased muscle tone, again to facilitate that muscle tone. If they presented with hypertonicity, then I would want to use inhibitory techniques to decrease that muscle tone because it's already increased. Some inhibitory techniques are prolonged stretch, inhibitory pressure, maintain touch, slow stroking, neutral warmth, slow vestibular stimulation, rhythmic rotation, and spray and stretch. And then for some facilitory techniques would be the quick stretch and tapping, resistance, joint approximation, traction, light touch, manual contact, PNF, and then vibration. Also, what you might see and use for both of these techniques would be weight bearing and then also vibration, but vibration is usually more for facilitory. Again, just knowing the importance for the PTAs, knowing which techniques to use on which patient. So if my patient comes in with a stroke and their arm is stuck in that, let's say the flexion synergy, then I'm going to want to use some inhibitory techniques to try to release that. If I have let's say I have a spinal cord patient come in and they can't even flex their arm to 90 degrees, then I want to try to use some of those facilitory techniques to try to get that muscle to activate. As far as like the main content, what I wanted to cover for inhibitory techniques was rhythmic rotation and prolonged stretch. So rhythmic rotation is basically just moving a patient's body part to have their nervous system calm down and turn their muscles. So you would have like their knees together and then move their trunk slowly side to side. For prolonged stretch, you would just stretch them in, let's say again we have that upper extremity flexion synergy going. You're going to want to take them into a stretch and hold it there so that hopefully the muscle eventually starts to loosen up and release that tension and you can get a little more motion in it. For facilitation, one you want to use is joint approximation, so getting the joints closer together, like if you're trying to get, like a child to sit up and prone, you might want to approximate their shoulders down towards their chest, and then also quick stretching, so making sure that you're moving that joint fast to really try to get that muscle to activate, or tapping on a specific muscle, the specific muscle you want to activate. So let's say we're going for our biceps, you want to tap here, and then it'll kick in. A contraindication you need to be aware of is for joint approximation. If the tissue is inflamed, we do not want to perform this. Some benefits of inhibitory techniques is that it decreases the signals from the brain, from the muscle to the brain to help it relax. Again, you can relax through like neutral warmth. It also helps with promoting better control of movement by decreasing overactive muscles and then managing pain. For facilitory techniques, it can help increase signals from the muscle to the brain to help make the muscles fire. It can help regain functional independence through those movement patterns and better muscle activation. Joint approximation enhances muscle co-contraction and postural stability. And then the quick stretch and tapping helps to aggravate the agonist, the muscle that's working, and inhibit the antagonist, the opposite of the muscle that's working. And then also for inhibitory techniques for rhythmic rotation, it helps to decrease the tone in the trunk by doing that slow movement. And for for prolonged stretch, it helps to inhibit contraction of the muscles. So just some key takeaways that I just want to reiterate was, the facilitory and inhibitory techniques I just covered. The purpose of each: facilitory is basically to make the muscle fire, inhibitory is to make it stop firing. PTAs need to know this because we see patients with this on a daily basis, so we need to know how to treat it. If we have a patient coming in that's already hypertonic, we don't want to be doing facilitory techniques and make that even worse, and vice versa for inhibitory techniques. Again, just make sure to not use joint approximation with any inflamed tissue. Again, understand why this is important for us. Know that we have multiple options of these patterns to use in case one of, let's say the prolonged stretch is not working for the inhibitory technique, then we can go to the rhythmic rotation or neutral warmth or whatever else is out there. But thanks for listening, and that's all I have.